Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Chronic obstructive pulmonary disease, COPD. Introduction. Chronic obstructive pulmonary disease, COPD, is a common disease of the lungs that makes breathing harder. This program will help you understand better the causes, symptoms, and treatment options for COPD. Anatomy. Oxygen is vital for life. Without it, death occurs very rapidly. The lungs allow us to fill our blood with oxygen. The air we breathe comes in close contact with the blood in the depth of the lungs. The blood then fills up with oxygen and releases unwanted carbon dioxide, CO2. When we breathe, the air goes through the mouth and/or nose. From there it goes to the air pipe, known as the trachea. From the trachea, it goes into an increasing number of smaller tubes called bronchial tubes. Small, balloon-like sacs called alveoli are at the end of the tubes. The walls of the alveoli are very thin. On the other side of the walls, small blood vessels exist. The very thin wall of the alveoli allows the oxygen to go into the bloodstream and also allows CO2 to go from the blood to your lungs to be exhaled. Muscles surround the bigger bronchial tubes. The inner lining of these bronchial tubes secretes special substances called mucus. The mucus helps trap dirt from the air. Mucus is continuously expelled from the lungs. Very small brushes, known as cilia, on the outside of the lung cells continuously push the mucus to the outside. If the mucus becomes sufficiently big, it is coughed out. Symptoms. COPD is the name given to a group of conditions that make breathing difficult. These conditions include emphysema, chronic bronchitis, certain forms of bronchiectasis. Frequent coughing and thick sputum may be common. Wheezing can also occur. Patients have difficulty catching their breath. Even minimal physical activities become very difficult to perform because of the shortness of breath. Supplemental portable oxygen may be necessary for survival. Lung infections known as pneumonia become frequent. Weight loss and depression may follow. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Active or passive smoking is the major cause of COPD. Exposure to other irritants and pollution can also harm the lungs. There are also rare genetic conditions, such as antitrypsin deficiency, that lead to an increased number of lung infections. Severe lung infections can also damage the lungs. Smoking, irritants, and lung infections can cause inflammation of the bronchial tubes, the alveoli, and most of the cells lining the inside of the lungs. Inflammation causes thickening of the bronchial tubes and alveoli. This causes narrowing of the inside of these tubes and a decrease in the capacity of the lungs to exchange oxygen for CO2. The cilia also become unable to expel the dirt accumulated in the lungs. This causes thick sputum to develop, which cannot be coughed out easily. This causes further inflammation and infections that worsen the condition. A vicious cycle is created. Diagnosis. After taking a detailed history and listening to your lungs, your physician may ask you to take a test known as a pulmonary function test or spirometry. This test aims at determining how well your lungs are functioning. A chest X-ray may also be done. Specialized blood tests can check the amounts of oxygen and CO2 in your blood. Treatment. Preventing COPD is better than having to treat it. Avoiding smoking and the smoke from others is essential in preventing the lung damage associated with these diseases. Avoiding other irritants and pollution is also important. Likewise, repairing lung damage is very difficult if the patient continues to be exposed to smoke and pollutants. In cases of advanced lung damage, patients can take special measures to help decrease the symptoms. Humidifiers may help. Bronchodilators, medications that open up the bronchioles, may be tried. Steroid medications, such as prednisone, may help decrease the inflammation and may help alleviate some of the symptoms. Chest physical therapy may help in improving the cough and expelling dirt from the lungs. Exercising under the careful supervision of your healthcare provider can help lessen shortness of breath over time. Do not start an exercise program before first checking with your healthcare provider. Antibiotics may be necessary to fight infections. Supplemental oxygen may also be necessary. However, eliminating exposure to smoke is the most important measure. Patients with COPD should get the flu shot on a yearly basis. They should also get the pneumococcal vaccine. This vaccine prevents certain types of lung infections or pneumonia. Revaccination may be necessary after 5 years in those older than 65 years of age. Recently, some surgical procedures have been used in the treatment of these conditions. They are a last resort, and unfortunately they are not very successful in alleviating the symptoms. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. COPD is a chronic lung condition that could potentially be fatal. Significant advances in understanding and treating these diseases have been made in recent years. The most important way people can decrease their risk of getting these diseases is to stay away from smoking. Thank you for using Explain.